Tonight, Ebola fears heightened as Yale New Haven Hospital in Connecticut treats a patient suspected of having the virus, and the nation's largest union of registered nurses says the system has failed them. Tonight, a representative of the New York State Nurses Association speaks to RFL about what she believes worries nurses and other hospital staff the most. And with the lowest approval rating of his presidential career, President Obama, he's getting a lukewarm welcome along the campaign trail from fellow Democrats. That, of course, ahead of the midterm elections in just over 2 weeks. This is a Clinton stump across the country. Are they taking over the president's turf? Plus, colleges and universities across America adopting a new sexual assault policy that calls for verbal consent between both parties. Seems like a step in the right direction to combat sex assaults. But why is Harvard holding back? Good evening and welcome to RFL. I'm Richard French. Thank you so much for joining us tonight. And we're going to begin here with the issue that, frankly, talk about anybody at the table here tonight. It's all people want to talk about. It's what questions are out there for, and it's certainly where Congress was focused on earlier today. I'm talking about the Ebola outbreak and yet another community on alert due to a suspected case. Well, today, officials at Yale New Haven Hospital in New Haven, Connecticut, they're monitoring a person who they say has Ebola-like symptoms. The patient in isolation while doctors await Ebola test results, which should be made available tomorrow. Connecticut Governor Daniel Malloy ordering all hospitals across the state to test their preparedness to handle possible Ebola cases within the next week.
We have been taking this situation very seriously for weeks. Over the period of time, we have been working with health officials to prepare for a potential case of Ebola coming to Connecticut. Last week, I issued an order declaring a public health emergency as a precautionary matter. The order gives the Commissioner of Public Health the authority to quarantine and isolate an individual or group of individuals whom they reasonably believe has been exposed to the Ebola virus.
And we have word just coming across now, and you'll see my guest in a little bit who can confirm it herself here, but a nurse on scene, they've got a confirmation within the hospital, thankfully, that the case is not Ebola related. A test came back negative here. You'll get official word later, but that's the initial report here that we can report to you on RFL. But outside of Connecticut, some people who may have come in contact with a second Dallas nurse who contracted the virus, they are being quarantined. Several schools have been closed, cleaned. Passengers who boarded the same plane from Ohio to Texas as Amber Vinson have also been notified about their exposure or potential exposure. Authorities say Vinson had a 99.5-degree fever and should have never been allowed to board that flight. Vinson and her co-worker, Nina Baum, they have been transferred to hospitals out of state that are better equipped to deal with the disease. Now, nurses across the country, they are expressing real concerns and even fears about contracting Ebola and say they want better training because many of them do not feel prepared to treat the virus. These are outstanding questions about protocols. Now, the Nurses Union, National Nurses United, the largest union of RNs in the U.S., they have come out swinging. Roseanne DeMora, the union's executive director, released the following statement saying, quote, "We've been attempting to get hospitals in this country to actually hear the nurses' concerns. We've been told a lot of things that have been wrong. We have been lied to." Well, today I spoke with Lisa Baum, who is an occupational health and safety representative for the New York State Nurses Association, about some of her and her representatives' concerns. I want you to take a listen to what Brianna Aguirre had to say. Now, she's a nurse at the hospital in Dallas at the Texas Health Presbyterian.
We never talked about Ebola, and we probably should have. We never had a discussion. They gave us an optional seminar to go to, just informational, not hands-on. And it wasn't even suggested that we go. It wasn't, something that they said, you really should try to make it. It was, I believe, only offered once, if not twice. We never were told what to look for. And I just don't think that any facility in this country is prepared for that at this time.
Have you run into some of those same frustrations she articulated in New York hospitals you've spoken to?
There is a wide range of preparedness of hospitals in New York State and throughout the country. Some hospitals are well prepared. You've heard about Emory, Nebraska, and some others. In New York City, Bellevue is very well prepared. Other hospitals are not. And really, a walk-in patient could come to any hospital in the country. There are two different levels of preparedness that hospitals have to have. One is to quickly identify and isolate a patient who is potentially infected with Ebola virus, and the other is to be able to treat a patient. Not every hospital necessarily has to have the means to treat the patient, but they all must have the ability to quickly identify, triage, and isolate the patient. And if that patient is then going to be transported to another facility for further testing and treatment, they need to have procedures in place for that as well.
Curious, Lisa, when you talk to some of these nurses, I've heard some feel that they've been left out there on their own to a certain degree, that they haven't gotten the right protocols, they haven't gotten the right training, and some of the exposure that we saw in area hospital where the caregivers didn't have the right equipment wasn't still available at their hospital. Are those some of the biggest frustrations you've heard, or does it go beyond that?
Nurses have expressed frustration over a lack of training, a lack of education, a lack of protective gear, a lack of written procedures, a lack of simulation exercises, all of which need to take place. In the past few days, we have seen a number of hospitals step up their preparedness. And a lot of that is due to the advocacy of unions such as the New York State Nurses Association and the National Nurses Union to speak out on behalf of nurses within the state and nationwide.
Lisa, I'm hearing varying accounts as to how long it's going to take to correct the problems you just mentioned. Some say within 48 hours the equipment that's lacking at certain hospitals will be there, including the protective gear. I'm hearing for others, they don't know when they're going to get it. What are you hearing in terms of a timeline to address the concerns that you're hearing articulated on the front lines with the nurses?
It varies by hospital. If your hospital needs to build proper isolation rooms, then obviously that's going to take a while. If the question is simply getting more personal protective equipment in, stepping up training, stepping up triage procedures, that can be done relatively quickly. One of the key problems we see is understaffing, because you not only need to have a lot of staff to care for a potentially ill patient, you need additional staff to do training, and you need additional staff for triage procedures. And I'll give you an example of this. At Bellevue, they decided that they would have someone walk the line of people who were waiting for initial triage and ask questions. If the answers to any of those questions raised concern about a possible exposure risk, then that person could immediately be moved ahead, placed in isolation, while further questions were asked. This is a good procedure in terms of protecting other people in the waiting rooms as well as staff. But you need extra nurses to do that. And hospitals have been cutting over the past few years, and now we see the consequences of that.
Lisa, last thing, with all this being said, and obviously today, the folks in New Haven dealing with a potential a case there as well, do you believe that the public concern, if not even outright fear, has overtaken the reality of just how hard it is for Ebola to be transmitted from person to person? Or do you think if the public is, if in fact a little scared right now, or even some of the nurses have this concern, it's justifiable?
I think there's a very different level of risk to the general public as there is to a healthcare worker who is working closely providing care to a person who has a confirmed case of Ebola virus disease. I think there's really limited exposure risk to the general public. There's very significant risk to the healthcare worker.
Well, Lisa, I certainly appreciate a few minutes. Thank you so much.
Thank you.